adult woman worldwide should have and visit a gynecologist. Gynecology, the study of women's health. Gynecology was founded by the physician James Marion Sims as he pioneered surgical techniques and tools. These techniques and tools were developed through the unethical experimentation of African American slave women and children. Sims' new surgical techniques would be performed on African American slave women without anesthesia. He operated under the racist notion that African American women did not feel pain as their white counterparts did. In one of numerous accounts, an 18-year-old slave girl by the name of Lucy was one of the first Sims would operate on. Lucy had just given birth and could not control her bladder. Lucy would endure an hour-long surgery in which an unsterile sponge was used to drain her bladder and she would contract blood poisoning. During all of this, a dozen other physicians were in attendance and watched as she screamed and cried out in pain. Lucy would take a full 2 to 3 months to recover from the operation. Before and after his gynecological practices, Sims would experiment on enslaved children in efforts to treat neonatal tetanus. Sims would use shoemaker tools to loosen their skulls and pry their bones apart. Sims believed that African Americans were less intelligent than white people because their skulls grew too quickly around their brains. Today, Black women are 3 to 4 times more likely to die of pregnancy-related causes than white women. Factors that contribute to the disparity include quality health care, underlying chronic conditions, structural racism, and implicit bias. Black women have begun to speak out about being disrespected and devalued by medical providers. New and expectant Black mothers say that nurses and doctors don't take their pain seriously, a notion tying back to 19th century beliefs. In a survey conducted by an institution, a study found that 33% of Black women say they have been medically discriminated against, and 21% avoid going to seeing those healthcare professionals for fear of being discriminated against. A CNN article states that Black newborns are more likely to survive childbirth when looked after by Black doctors, but 3 times more likely to die when looked after by white doctors. When Black doctors took charge of the birth of Black babies, the mortality rate of newborns struck from 58 to 39%. This data can be linked to institutional racism and can even be traced back to the generational trauma that the ancestors of African Americans were forced to endure. Righting the wrong. Although the Black infant and mother mortality rates have begun to decrease, the gap is still in place. This gap can be removed with the proper education regarding racism, racial bias training, and the termination of institutional racism in the healthcare system.